Surgery, huh? It's not what it used to be, right?
Like,
I mean, huge scars, months of recovery. Thankfully, things have changed. Today, we're diving deep into minimally invasive surgery. You've probably heard it called MIS. We've got this awesome podcast made for surgeons. We're picking apart, pulling out the coolest, most interesting parts. So, ready to make our incisions and get right into it.
let's do it.
Okay, first things first. When we say minimally invasive surgery, what are we actually talking about?
So minimally invasive surgery, or MIS, it's all about using these specialized tools and techniques, right? And what it does is it lets surgeons perform surgery through, get this, smaller incisions, way smaller than traditional open surgery.
Okay, so smaller incisions, less trauma to the body. Makes sense, but why is that such a big deal? I mean, are smaller scars really that revolutionary?
It's definitely not just about the scars, although, hey, who doesn't love a smaller scar, am I right?
True, true.
But seriously, think about it. Smaller incisions mean less pain afterwards. You recover faster, and there's way less chance of complications. And let's be real, less time in the hospital, quicker return to your routine. I think those are some pretty awesome wins.
It's not just less invasive during the surgery, it's like less invasive on your whole life.
Exactly. It's about getting you back to doing all the things you love and, without all the hurdles.
That's huge. Okay, but what kind of procedures are we actually talking about? What falls under this whole MIS umbrella? I mean, we're not talking about just like removing a mole here.
You would be surprised. It's come a long way. Like one pretty common example is laparoscopic cholecystectomy.
Okay, hold on. Got to pump the brakes down. It sounds a little intimidating. Break that down for me.
Okay, so laparoscopic cholecystectomy, basically it's removing your gallbladder. But the cool part, with MIS, they do it through these teeny tiny incisions in your abdomen. They use this tiny camera, it's called a laparoscope, to see inside. And then they've got these specialized instruments, again, super small, to actually take the gallbladder out.
Wait, so no big incision. That's wild.
Yeah.
What else? What other procedures can they do like this?
Honestly, laparoscopic cholecystectomy, that's just the tip of the iceberg. I mean, we're talking everything from appendectomies to your hernia repairs, even more complex stuff like hysterectomies, and get this, even some types of heart surgery.
And it's not just the types of procedures, right? The technology itself is changing. We got to talk about robotic surgery.
Right. It's like not sci-fi anymore. It's here. Robotic surgery is really changing the game for MIS.
Okay, but paint me a picture. Are we talking like full-on robots in the operating room making their own decisions?
Well, we're not quite there yet. Not that autonomous, but honestly, it's getting close. Think of robotic systems kind of like the surgeon's super high-tech assistant. So imagine this. The surgeon's controlling these incredibly precise robotic arms, and they have these tiny instruments. The surgeon's got this magnified 3D view of everything happening, and they can make the most delicate movements inside the body.
Whoa, it's like they have superpowers. Okay, so it's still the surgeon's skill, their expertise, but this technology just takes it to a whole other level. What does that mean for outcomes then, having that level of precision?
It's a big deal. Robotic surgery can often mean way less blood loss, which makes a huge difference in recovery. Plus, usually less pain after surgery, and patients are back to their normal lives way faster.
Okay, this is all sounding amazing, but there's got to be a trade-off, right? I mean, learning to use this technology can't be easy.
You're right. It's not like flipping a switch. There's definitely a learning curve. Surgeons need specific training, and they really have to dedicate the time to master these robotic systems.
Yeah, it's like learning to drive a car versus flying a helicopter.
Exactly. And it's not even just the technical stuff. There's a whole ethical side that's super important. Informed consent is huge. Patients need to know the good and the bad, the benefits and the risks of robotic surgery. And, of course, how much experience the surgeon has with these systems. It's all about making informed decisions about your own healthcare.
Absolutely. It's got to be a partnership. Okay, so we've covered a lot of ground here, but what about the future? Where's all this going? What's next for minimally invasive and robotic surgery?
This is where it gets really cool. We're talking about things like artificial intelligence that can actually assist surgeons during surgery in real time. And augmented reality that can give surgeons X-ray vision during procedures. Imagine being able to see through tissues to navigate really complex anatomy with even more accuracy.
That's mind-blowing. And this isn't way off in the future, right? This stuff is being developed right now.
Totally. And listen, it's not about making things fancy or high-tech just because. It's about using technology to get better outcomes for patients, make sure there are fewer complications.
It's like surgery is becoming less about, going under the knife.
Yeah.
And more about this really targeted high-tech healing process.
Totally. And Like what we've been talking about, it's not just about the technology for technology's sake. It's about, a better experience for the patient, shorter recovery times, fewer complications, you're back to your life faster. That's what minimally invasive surgery is all about.
Yeah, it's almost like the goal is to make the whole idea of surgery less scary, right? Like if you need a procedure, it's not about weeks of downtime anymore. It's about getting you back on your feet, feeling good, and hey, maybe a little less scarring too.
Right. Minimizing the impact on your life, but maximizing, the benefit to your health. And the best part is, this is just the beginning. As technology gets even better, we're going to see even more incredible advancements.
It really is incredible to think about where we'll be in a few years. This
Mhm.
whole deep dive has been amazing. You don't get to peek into the future of surgery every day.
I know, right? It's a pretty exciting time to be in medicine and the pace of innovation. Who knows what kind of breakthroughs are right around the corner?
I know. Well, it's been awesome exploring all this with you. And for anyone listening who might be facing surgery, remember, it's not what it used to be. Don't be afraid to ask your doctor about these minimally invasive options and stay curious. There's so much cool stuff happening in medicine all the time. Until next time, keep on diving deep.